Hey everybody, I've got Karen Korona with me here today, and I'm so excited because she is a holistic health practitioner out of Littleton, Colorado, but people fly in to see her from all over the world. And she has helped me so much. She's been practicing this for 37 years, providing healing treatments, workshops, and retreats for thousands of people worldwide. She offers healing and wellness counseling in Ayurveda, Kundalini yoga, meditation, and mindfulness techniques for people to obtain their own vibrant health and balance in their daily lives. Karen has worked with autoimmune diseases, in her holistic practice while collaborating with medical doctors to bring the best possible healing and care to her clients. We'll get into that in a second because she has worked with Western doctors too, and they have promoted her also. Karen lives in Littleton, Colorado, like I mentioned. She offers you office appointments and virtual sessions. She is currently writing a book on healing and anti-aging. Look at her, right? On anti-aging using Kundalini breathing and yoga.
Yay!
Yeah, right? But anyway, she's part of the reason I look like this, right? She's like, yes, I do. So Karen has really helped me quite a bit. And over the years, she's taken me from cane to no cane, cane to no cane. How did you get up my front stairs? You ring my doorbell, right, Karen? So I surprise her sometimes with my healing. So Karen, why don't you let us know exactly what you do, and we'll go from there.
All right. Well, that was a really good introduction. So yeah, I've been doing these healing treatments, and I'll talk about that because we have healing treatments and the counseling that I do. And then, I give people home programs and techniques that they can use for their self-healing. And, I guess I want to preface all that to just say that over my years of practicing that, the body has such a potential to heal if we listen to it. And what it aims to do is to go back to its original nature, its original balance, but it's looking for that. It's looking for it. And in autoimmune disease, it has lost that inner barometer. It's forgotten what to do. The messages have gotten confused. So say someone's had a virus or something like that, or a couple of viruses. You can have a couple of pathogens like yourself, Jenny, so that it's interrupted all of the messages that need to get through to the body and the brain. And so then the autoimmune system is, it's overworking. It's constantly attacking not only the unhealthy cells, but the healthy cells. Yeah. And it's just all confused. And it's also on overdrive. And we certainly have found that with you and the other people that I've worked with. So it's been my quest to say, how can I really help people in their bodies with my treatment so that we can come to balance and we can get that neural circuitry of the brain and the circuitry, the electrical circuitry in the body so that it's sending the correct messages. So those pathways are open and connecting. So part of what I do is called AcuTouch therapy. And it is a light touch therapy. I use different centers in the body, these energy centers, which are very similar to acupuncture points. And there's like one center, say like in the hand, acupuncture might have 5 different places they could put needles, but we have one center that's the center of point of all those points. But it's similar to acupuncture where it works with the energy meridians. And it works with all the organ systems, body systems, brain, endocrine system, everything. But what I like about this technique is that
Excuse me for a second. Is it similar to acupressure, or is it similar or different?
Yeah, so it's light touch. It's light touch versus a deeper touch. Yeah, and the reason we have to use light touch is because we have to feel the palpitation of the energy, the electrical energy going through. And it is different than acupuncture because like if you put a needle in that point in acupuncture, it's working in that area. But when we can use 2 hands with the light touch, we can help open up not only the energy centers, but the pathway, and redirect the energy and show it where to go. So,
Yeah.
this energy we're talking about is like the electrical energy in the body, the chi, the life force. It's been called many, many things. And, when I got started, 37 years ago, this is very unusual. We didn't have all these other, Reiki, and, you didn't hear about all these other things. So it was quite unusual. I just feel very blessed that I was given and learned this technique. I've trained with different master teachers from different parts of the world. And so I can present this eclectic approach to healing based on, all the knowledge that I've gained. But I like this technique very, very much because it uses the light pressure. Somebody say who's been in a car accident, and if you use a deep pressure, their body, right? Their body has been, it's in protection mode because it's kind of have your post-traumatic stress syndrome in the body, could be in the brain too. So this way we can get through, we can feel the pulses of the electrical energy. We can guide the energy from one point to the other. The hands are used like little jumper cables to start, just like you would, to charge a battery in your car. It's a jump start. And then we direct and redirect the energy. So, how is this, helpful is that now these messages are getting through. And consider this, if a message does not get through, and we know this in the brain, you can relate to this, Jenny.
Well, I was just going to say before I forget, the cranial sacrum working for me when the chiropractor said you need to get cranial sacrum therapy, and I called you and you said I do that too, and actually you absolutely helped me with that, and all of a sudden I was fine again.
Exactly. So if we think about the electrical impulses in the brain, those are the neuroreceptors that have to be charged so that messages get from one part of the brain to the next, from A to B to C, and it just has a very quick charge. And everybody's heard about that, like, oh yeah, those electrical impulses need to get through. But we have to do the same in the body. We have the same electrical impulses in the body. So we're working body and brain with the AccuTouch. I had a doctor refer, this was several years ago, a little 5-year-old, she was a little girl, and her mom came in and they had a doctor's referral. And I said, oh my gosh. And he wrote, I still to this day don't know who he is, but he wrote to me saying, connect the electrical impulses in the colon, because she was having trouble with the colon. She already had some of her colon taken out. Her colon wasn't working. And, so I'm like, this is fantastic, a doctor understanding this. So, she comes in and I start working with the little girl, and sure as all, she did not have to go through a second surgery, and her colon started working. And sometimes it's that easy because those electrical impulses are going through, sending the messages to tell the colon what to do, or the brain, or any part of the body that we're working with. So that's the AccuTouch. And then we get to the cranial sacral, because I do that too.
Sorry about that.
Cranial sacral. Who doesn't love cranial sacral? What is that? Okay, so cranial has to do with the cranium, sacral has to do with the sacrum, and everything in between. All right. So we work with the bones, and it's a very, again, light touch holding techniques for the bones to move in their correct position. So it's not a chiropractic adjustment, but it's a very refined self-adjustment of the body that occurs with the bones as well as the brain. And consider we have 7 skull bones and we have 22 facial bones. So there's a lot going on there. All right, so let's look, and we can use you as an example, Jenny, because we have the cranial bones, you can relate to this. And then we have this dural membrane, excuse me. And the dural membrane holds the cranial sacral fluid. And so this fluid's got to pump from the sacrum to the cranium, and it's got to expand, and it's got to come down again. And it pumps like a semi-hydraulic pump. So in order for those neuroreceptors to get through, like we want, those messages to get through, we've got to have enough fluid going through the brain. All right. And so what we found with you is that with, is it okay if I say something about the Lyme?
Yeah.
Okay.
Yes.
Okay. That the Lyme really interrupted the neuroreceptors in the brain, so the messages couldn't get through. It disturbed that area. It disturbed other areas in your body as well, but especially on that left side. Yeah.
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 And so when we could connect, and it was just, you'd have a treatment, and then we do the cranial sacral work and the AccuTouch, and then the system would start remembering and start working again.
Yeah.
And, so in a way we're repatterning, so the body and the brain can remember, come back to that balance, and know what to do, right? So those messages have been broken. So
It was interesting because I didn't know I hit my head. So like the front of my head, I didn't know that. And the doctor didn't even know that that's what had happened. But all of a sudden he figured that out, and then you figured out, it's like, okay, which is wonderful.
So, so much of the treatment is, every treatment is diagnosis and assessment as well as treatment, because we have to say, okay, now how much has your body recovered? How much has it repaired itself? How much has it remembered? And it's retaining, it's holding on to that. So each treatment we go back in and we do the next step.
Mm-hmm. Now, do you use cranial sacrum for adults and children that have concussions, like from sports and obviously car accidents, falling off their bike, whatever?
Falling out of trees, falling out of bikes, I've had it all.
Football players. Yeah, no.
And how about the babies? It's terrible. The moms come in, they're crying, they feel terrible. Their baby, their 6-month-old or their year-old child has accidentally fallen out of the high chair or the stroller. Oh, they're heartbroken. So they come right in, and we just adjust those bones immediately. It can be adjusted. And like I said, it's very light. It's so, I work with the baby. Sometimes I work with a newborn, because even the birth, right, can compress those bones.
Yeah.
And so, we're just gently guiding the system. If it's the bones, if it's the membrane or the fluid or the organ systems, endocrine system, we're guiding it back to balance so it starts doing what it needs to do. And Jenny, if it doesn't get those messages, if that energy pathway, that electrical system is severed, it just doesn't get through. Right? Yeah. You know this.
I agree.
In your own system.
I do agree. Yes. So, and even babies, like you were saying, during birth or whatever, and I haven't had kids, so I'm just saying, like, what I've learned is that, think of someone that's as little as you or as little as me. Think if I had like a 10-pound or 12-pound baby. That baby's like smashed in there, and how hard is that baby to get out if mother says she does not want to have a C-section? She just wants to have it naturally. Well, that poor baby's coming out through your hip bones and everything else, and maybe his little or her little head is all smashed, coming out.
It's true. And luckily those bones are pliable, but it often, like I'm saying, like often meaning 90%, that's a lot of the time. The occiput, which is this bone at the base of the skull and the first vertebra, often compressed. And what we find is that compression will not release itself in a child's life. That we literally have to get in there and release it. And yet if we do, say right after birth or soon after, say in the first 6 months or so, it's fine. It's fine for the rest of their lives. It's just amazing to me to watch this, Do
you feel that babies that are colicky and things like that, do you think it was because of childbirth and maybe some of these issues that happen during birth? Or I don't know.
There's genetics involved there. So I had 2 children. One never had colic and the other one had it, 24/7. So luckily for this, and knowing the right herbs, and even with babies, you can give minimal amounts of homeopathic remedies and different herbs, and understanding the food and the diet, because sometimes they have allergies. But my son had terrible colic, and I don't know what I would have done without this work. I mean, I am teaching this work to other people, and because I think every mother should know this work. Every earache that comes along, every Everything that happens to your child in a child's life, and how many times they bang their head, etc.
Yeah.
I don't know what I would have done without this work, with the colic. I would have gone crazy. So yeah, it's exciting in that way. And then, the herbs and the Ayurveda. I love Ayurveda because it works with, again, bringing your body back to its original nature, or dosha, which is your constitution. And, we need to talk about stress, because if we look at autoimmune, of course, what makes it worse, right? If you really have an autoimmune disorder, your stress is going to throw you into another attack, right? And stress can also create it. So, we really have to look at that element to say, how can we calm the body and the body system so that it can start its healing process? But stress is a big factor. So that's why I use these other techniques, Jenny, because, knowing the herbs and the foods, because Ayurveda is so much about using food as medicine, correct for your particular dosha, or your, when I say your dosha is a constitution. And your dosha, that constitution becomes, like whatever it is. So if you have a health condition, that's the dosha we start with. That's the masking dosha. That's not your real one. That's what you've been left with. And we have to start there with foods and supplements, and then we can move you into that original dosha and bring you back to balance again. And so Ayurveda works with the foods and the supplements, but it also works with our lifestyle and very much supports, low pack. I want to say, if you do exercise with autoimmune, I love the Ayurveda because it really stresses this low pack exercises. So you're not overdoing your system. Again, you're not stressing your system, but you find what's the right balance for you. We know this with you, Johnny, because there were times that you would go and exercise, it would be too much, and that would create more inflammation, right? And that's what we would consider that's too much. It's too much. And
you
then
said that same situation happened again.
Yes, exactly.
The therapist didn't believe me when I said, I really can't do that. She's like, yes, you can. And I'm like, okay. And then I thought, okay, I'll be fine. And then I was down for a week and a half. I was like, oh my God, like I've never had pain. I had the worst pain I've ever had in my life. I was like, so
it's not worth overdoing. And to know, like, any physical stress is overdoing. And so knowing the right amount and knowing how to breathe, I love this Kundalini yoga where you're doing so much breathing and working with your chakras and your organ systems. I really use the Kundalini for healing the body and coming back to homeostasis, so it's very healing. That's why my book is all about that, healing and anti-aging. And I've used it for years, and it's like a remedy. There's like a prescription in Kundalini yoga for each health condition, right? There's very specific exercises for inflammation or for that part of your body. It could be the lungs, because we work so much with your lungs, right? There's or the liver or the gallbladder or the kidneys. It's very specific. So I enjoy that. And of course, our meditative techniques to know, and I give people particular techniques in meditation that are going to help them to heal,
Yes.
Whole lifestyle. Sometimes when people get sick, they have to have a whole lifestyle change. I'm sure people that are listening to this with autoimmune, you understand what I'm talking about. Like people say, oh my God, I got to clear out my refrigerator. I can't use that ketchup anymore. I can't do this. This creates inflammation. That creates inflammation. But the ingredients in it, if there's any additives in there or lots of sugar, it's going to throw you right into inflammation.
Yeah, it's true. And a lot of people don't understand that dairy is a total kicker. Bring up the inflammation, sugar. I mean, all this is just, then I say to myself, I'm like, well, then what am I going to eat? Like, what would you know? So, and people can come to Karen and kind of do a whole body reset, but we'll put all your information up at the end of this, and everybody can find out how they can contact you and I'll put up your website and everything else. But I really just wanted to bring you on here so people would get an overview, like a high level overview of what you do. And then we can bring you in again, or bring you on again to talk about maybe specific autoimmune diseases. But if any of you have a question for Karen, we'll put up her email address also. You can send that to her, or you can get in contact with me, and we can exchange information and things like that. Because I think it's very important right now, because so many people have been at home. We all have pretty much the last year, and we've just been sitting around not doing a lot because you couldn't get to the gym and things like that. And I do believe, I mean, most people have had to cook anyway, so why not cook in a healthy way? And Karen can help you with that. Right, Karen?
That's right. You know, what I'm thinking is next time we can get on, I can maybe show a technique, a breathing technique,
Yeah,
you know,
absolutely.
and we can maybe talk about a particular food that would be good for people with inflammation, etc. Yeah, we could do something like that, just to really give people, education is everything. And what I really want to leave people with, Jenny, is that the body has the potential to heal itself.
It does.
If we listen to it, if we give it what it's asking for. Sometimes that's the difficult part, because we say, well, what is it asking for? Why is it going into this reaction? And so frustrating. I know I work with so many people over the years, but I have seen bodies heal. Then there are people who maybe have a disease for, 10 years, 15 years, and I'm watching the body heal. And I say to people, whatever the potential is, Jenny, whatever it is,
Right.
if it's, 10%, if it's, 30%, sometimes it's 100%, and sometimes it's in one treatment. That's great. So other times it takes longer. It's going to take more than one treatment. And maybe that person's only going to get 50 or 60%, but everybody gets something. And I've watched the miracle of this beautiful body that we have and our creation, and how we can respect it and love that part of ourselves and bring it back, and really come back to that balance and have a good life again.
Yeah. So the one thing, Karen, that I really respect about you is that you never tell anybody to stop seeing their Western doctors if that's what they need to do. I mean, if they have to take their heart medicine, then they have to take their heart medicine. It's like, I have blood pressure. It's not like that's going to go away overnight. And she's not like, I don't have that, by the way, but I'm using examples that you never tell somebody to stop taking their Western medicines, but eventually sometimes they get better from anything. I mean, from diabetes, like everything, and maybe with the diet change, because I never even knew that autoimmune diseases include diabetes, type A and B. Like, I didn't know that. And wouldn't it be wonderful if Karen could help you, like, get your diabetes under control?
Oh, yeah, it's very exciting. I want this work. I had somebody new come in the other day, and his wife sent him in. It's really great. I love when that happens. And he's sitting there looking at me. I said, you know what? I wouldn't be doing this for 37 years if it didn't work. If I didn't watch people heal, right? I wouldn't be doing this, but I've been doing it for a long time. And I really, really enjoy it because it's so exciting for me. And, it's kind of a challenge. And, oh my gosh, okay, here's all of it, what we have to work with. Here's all the symptoms, and let's get to the cause, and let's start working on this. And then let's start watching this miracle happen in the body. So to me, it's very exciting, what the potential of the body, where we can go, what can happen. So I have healing stories. That's a whole nother book. I'm gonna write a book on all my healing stories for people. So it's, and if you can, like this man that I worked with the other day, he settled into it and that got in, and he said, oh, okay, maybe this can work for me too. That's what he said. Because a lot of people think, oh, it can work for everybody else, but it won't work for me. Right. So said, yeah, it can work. It's going to work for everyone. We have the same nature, all of us. And, just because it got confused doesn't mean it can't come back. But we work with the fullest potential. Yeah.
Everybody knows I've been a tough case for Karen, but But hey, you know what? Sometimes I'm the one that got the Lyme disease and everything else. I walk down the street. Well, I'm not walking that well right now, but I just get outside and they're like, hey, can I come into the party too? And I'm like, no, there's no more room for you. Oh, okay. But a lot of us pick up these things, not that we want to, but Karen knows exactly. She's like, oh yeah, I know exactly what's going on. And she'll tell me, and I'm like, how do you know? I haven't even told you what's going on yet. So she works on me remotely, which is weird because I can feel it. And then she works on me like face to face also. But right now we're doing more remotely. But if you get up her stairs, by the way, like I said about the stairs, she'd be like, how'd you just get up the stairs? There's like one stair or two stairs to get into her house. And I'm like, I did it. Right. Or I couldn't do it when I got there and her son or herself would help me. And then by the time I left, I'm like, okay, I'm fine. So, I mean, it's not like you give me a magic pill or something and I walk out. It's not like that. So I really want people to understand that Karen is the real thing and I love her to death, totally believe in what she's doing. And I want all of you to be able to get in contact with her, especially people that feel they've tried everything and nothing's worked. Right? Yeah. Karen gets a lot of those too.
Well, yeah. That's most of the people I see, right? Yeah. Most of the people.
It's like the last, I just don't want you to always be everybody's last. Right. The only way you're going to live anymore is if you see Karen. No, see someone like Karen ahead of that.
Right, exactly. You don't have to go through all those other, and people have gone through 5-10 years of just looking and trying, which is great. Yeah. And there's a lot of techniques out there, but you're right, Jenny, like I just work with where people are, some people say, I just want to go 100% holistic. I'm like, great. People say, I still want to work with my doc. I'm like, yes. And I definitely suggest you get your blood work. We get our markers, we really check a person. I'm not, I have a medical background prior to doing this work. And so I'm very much into saying there's a purpose, there's a right purpose for that work. And honor those people. And, I work with a lot of different doctors and they refer clients to me. But because we have such a respect for each other's work, and those are the doctors, those are the MDs that care about their patient. And they've tried, I hear from them, we've tried everything. We don't know what to do next. So why don't you give it a shot, That's what they tell me.
Like, okay, I'll try.
Sure. Yeah. And then I do, there's a lot of people that start, on 15 meds, 20 meds. And, as their body strengthens, they don't need those meds and they're, seen by their doctor. We work with the doctor and we wean them off those medications. Sometimes they still are on 1 or 2, or sometimes they're off 100%. But, we work with whatever that person needs, whatever's in the best interest at that time. And honor whatever the body can do at that time, and work with it. Just work with it. And you're right, Jenny.
I always say to you, Karen, I'm like, can I go off of that medication? Or you're like, ask your doctor. Like, you never say, oh yeah, you could do that. No, she never told me to stop taking this or that or whatever. That was my choice or the doctor's choice. This has nothing to do with her saying that to me. But Karen does know quite a bit about CBD. A lot of you know, I own Jenny's Gold Standard. I rep all these CBD companies, but Karen knows quite a bit. So you can also chat with her about that also.
Yeah, exactly.
Anyway, I cut you off, but I was going to let you know we're about done with our time here. But please reach out to me, everybody, or Karen. I'll have all our information below.
Just below. That sounds good. Yeah. My website is so easy. It's my name. It's KarenKorona.com. It's K's. People say, okay, with the coronavirus. I'm like, no, it's Korona with a K. Same.
Exactly. It's not the beer. It's not the, And actually her email is KarenKorona@gmail.com. It's over in the corner. So, so please reach out to her or myself and we can get you guys in a meeting with her or consultation.
Yeah, I'd be happy to talk with people. And a lot of times people will say, would you mind if I talk to you 15 or 20 minutes and just ask questions and see if this is a fit for me, or, and I'm happy to do that. So, if they have questions and they're, considering coming in or taking this holistic route, I can take some time on the call with them. We can make that decision. Yeah.
Thank you, Karen. That's so nice of you to do that. Anyway, I'm going to let you go because we're having a blizzard here in Denver.
We are.
We're like, hey, let's do it today. There's a blizzard. We're all stuck at home right now. But why don't we always have these great people on the day we're having like the craziest snowstorm ever? But it's easier because we're all stuck at home. Karen has to go back and shovel some more.
Yes, that's right.
I know, right? Anyway, I love you, Karen. Thank you for being on today.
Thank you. Love you too.
Thank you very much. All right. Thanks, Karen.
Namaste.
And you guys have a great day, okay? And just get in contact with us, okay? Thank you. Have a great day. Bye, everybody. All right, we're done. That was good. I'm sorry if I went off on the cranial sacrum. I'm sorry that we went off on the cranial sacrum before you were going to talk about that, but it's like, well, you were doing like the touch. I'm like, what about I couldn't think of the word. I was like, oh, it's cranial sacrum. I'm like, okay, I have to do it now. I have to say it now because I'll forget. Yeah, my brain's a little
That's okay. Yeah, I get it. Don't worry about it. It flowed just fine.
I thought it did.
Because
sometimes you're just like, now what? Like, now we're going to talk about, well, it's easy. I mean, it's easy with you because I could know pretty much what you do, but I just had to hear it again.
Right.
So we could also talk about the other things I'm going to be talking to people about are like yoga and different types of exercise. Now, if you'd like to be back on, I'd love that because then you could talk about what you're doing and maybe the different autoimmune diseases, because they're like you were saying, you got into that they pushed Jenny too hard. Then, I mean, seriously, I will tell you, where's my little rollerball thing? I don't know, it's over there. From Homemade, which is the company that Pamela Orth is running right now. They had this rollerball stuff. There's arnica in it and menthol, like all these things. It's totally organic, totally vegan, everything. I seriously thought I had bone cancer about 3 weeks ago. My pain was so bad. It was so bad. And I've never had pain like that. I have once from antibiotics from a doctor, from a Lyme doctor, but because they were doing a really deep antibiotic, and I've had that, but never the bones and my muscles. I mean, Mark was like rubbing that on my back, like in the robe, and rubbing it in both sides of my legs, the front, the back, like everything.
Oh no.
It was so bad. It was so
Jenny.
And you have to do that. He would do that before he left.
Oh no.
He's pretty much my full-time caregiver now.
Yeah.
He's staying right now just because of the snow and everything else. But yeah. I'm like, you lay over there. He's like this the whole night. I'm like this.
Oh God.
Lying on my right or my left side the whole night. I'm like sleeping, and then all of a sudden, I don't know. I had to get that bladder stuff done this past week. Did you know? I don't think I told you about that, did I?
No.
Oh yeah. So this new neurologist sent me to a urologist, and he's like, you need to get that, what's it called? The urodynamic done. Well, ever since I got the urodynamic done, not so good. I almost feel like I do have an infection from it because they put a catheter up you, right? They drain your bladder. Then they put another one up you to fill your bladder up with water. Then they put one up your rectum because they're trying to figure out which of your muscles are working.
Right.
Then you're like this on this table. Well, what they do is a chair, and they put it down into a table. Then they bring it back up, and they have this bucket underneath you. So when you say, they say to you, just tell us when you have to go so bad that you pull over onto the side of the road and you pee in the bushes. And I'm like, well, I don't do that.
No.
I'm like, I don't do that. They're like, what do you mean you don't do that? I'm like, I don't do that. Like, I wasn't brought up to do that. You just hold it. So anyway, I held 500 cc's. And they're like, you have to go. And I'm like, I know, but I can't do this because I can't like pee into a bucket.
No.
It's the weirdest thing. It was the weirdest tape. And I was like,
No way.
so then she's like, all right. And their assistant, they're like, okay, we're going to go outside and we'll come back in at like 5 minutes and we'll see if you've gone. I'm like, I can't go. Then they're turning on the water. They're like, okay, well, just listen to the music. I'm like,
Oh
water. It's running water. And it made me go. She's like, if you don't go now, all of a sudden I get this. If you don't go now, then we're going to have to catheterize you again and get it out. I'm like, are you serious? I'm like, can I just go in the bathroom right there? Because they have a little bathroom in the room.
yeah, there you go.
So I'm like, can I just go in there? So here, they're like, we bought Markin. They'll help you get in the bathroom with your walker. They had that hat thing, whatever, to pee in that. I'm like, okay, now I can go. She goes, you didn't even pee it all out. I'm like, it's fine. It was like 200 cc's. That was it. Because she's like, it makes no sense that you don't want to go. I'm like, I used to show 20,000 square foot estates. I went to the bathroom when I got up in the morning, one time during the day. When I got home at night, changed my clothes, took a shower, went back out at night and went more. I said I would go like 4 or 5 times. She's like, well then, why can't you hold it all the time now? I'm like, probably because that's what I was doing.
Right.
And I kept saying, it's a Lyme. I'm like, the babesia is in my bladder walls. And she goes, the PA was like, anyway, you're MS. And I'm like, anyway, my Lyme disease. She goes, no, you're MS.
Oh, geez.
So she kept saying, and I was like,
well, it's not coming from that. They don't get it. And if you don't treat the cause, back to the cause, right? They're
yeah. So I'm like,
symptom.
it's terrible. So I just, so they ran Lyme tests again. The neurologist did.
Okay.
He goes, I don't know what this means, but your numbers are really high. Well, the IgG will be really high. And he goes, no, this is your IgM too. I'm like, that means it's really active if it's really high. He goes, well, I don't understand Lyme. So I know nothing about that. So now they're like running all these tests, doing all these things.
Right.
I'm getting EEG because I thought I was having little petite mal seizures. That's why I'm getting rid of the car.
Right.
But now he won't even, the neuro-ophthalmologist who's in his office, who said to me, come back and see me again if you're having an attack, which I am right now. They're saying, no, your neurologist will deal with that. So now they're getting an MRI to see if my nerves are inflamed. I'm like, do I need to fly back to freaking California to like get this figured out? I can see my neuro-ophthalmologist there, but the ones here are like, no, you're fine. We'll just put you on steroids if it's inflamed. I'm like, all right, fine. I'll just take Motrin, I guess, because I'm literally like, I said to Mark last night, there's like 4 of you. I said, I'm just.
Jenny, has he been running the eye program on you in the healing?
I don't think he knows what that is.
Okay, I'll talk to him.
He's not very, he, let's see if he's probably like, let me have him come in. He probably took off in his car, which I don't know why he'd do that, but he might have. I told him just to stay in here, but he's like, no. He's very like, no.
Well, it's still coming like anything here, so.
Isn't, or it is?
It is.
Oh,
it's going to keep coming down. I've got, I shoveled and, because people are walking their dogs and stuff, but now the rest of it, I've got somebody who's going to come either tonight or tomorrow morning.
Hey, Mark, are you there? Hey, are you there? Yeah. Oh, there. Sorry. Hey, do you want to come in? Okay. Yeah, I was just talking to Karen. She can say hi to you too. Cool. All right, are you outside?
Yeah.
We're gonna make that. We're gonna make. He was like, found this.
Good. What is it? Cauliflower or something?
It is with curry.
Oh my god.
I know. Because we made
with curry. It's not. It doesn't send you into inflammation.
Is it? Will that do it? Because I don't know. Oh, it will.
I usually use turmeric instead in the recipe, but I wouldn't use curry because even myself, I can't use too much curry, otherwise it will throw me into inflammation. So I can imagine what it would do for
You
you.
get puppy belly.
Yeah.
You do get puppy belly.
Right.
You're like, yeah. No, you're like this. You're like potato chip. But hey Mark. He's totally trying to. It's so funny. He's like, you don't have to be quiet. I feel like he's trying to be quiet. I'm like, we're done. But yeah. So I will put up your email. You want this one, the KarenKorona@gmail.com.
Great.
All right.
And then KarenKorona.com.
Do you want your phone number on there or no? Probably not. Say.
No, because it's going to be on social media, right?
Yeah, it's going to be on YouTube, Facebook, Instagram. Well,
Yeah.
Instagram.
Keep the email on. I mean, keep the email on, and we'll just take the no phone numbers. People can be so weird. You never know.
I know, right? I worry about you sometimes because I'm like, she's there all by herself while she has Zuzi.
Right? I have Zeus though.
It is. This is like, you know what? I am totally gonna like get you. Hey, how you doing? I think he's like trying to take off everything.
Right.
It's probably all wet. But so you're saying to use, instead of curry, use turmeric. It'll just taste different, right?
Yeah.
Okay.
What else is in the recipe besides the curry? What else is in it?
I think cinnamon.
Oh, yeah, you could put the turmeric.
Sullivan knows both. He's blowing his nose. I'm always like, wash your hands. I'm always like, wash your hands. The other day, when I wasn't feeling great, I'm like, you really have to wear a mask in here. Because we only wear a mask when we go to the doctors or go out, right? Which we don't go anywhere. I don't go anywhere with them, but we really don't do anything. Like, it's not like we go out to eat or anything. And I say hi to Karen. He's cleaning the kitchen. I'm like, no, come back, say hi to Karen. I'm like, he's coming back this way. He's coming around this way.
Hey, Karen.
How are you, Mark?
It's beautiful out.
Oh, isn't it? I was shoveling. I know how beautiful.
Yes, it makes me think of the headline several years ago, global warming conference canceled due to cold weather.
Oh, I love it. Right? Perfect.
You guys have fun?
We did, but hey, we're talking about the cauliflower. So she's saying that I really shouldn't have curry because it causes inflammation. But she was saying to substitute it with turmeric.
Okay.
So he's like, okay. By the way,
sprinkles on him, his portion, but yours I would keep away from the curry.
Well, he had heard that I could have this one. We're trying to figure out this autoimmune diet thing.
Yeah.
You can have 3 pounds of potatoes a day. The Russian, she did not like it when I said, hey, he heard that I was supposed to have 3 pounds of potatoes, and she's like, that was her face. I'm like, are you frozen? I think the camera's frozen. She goes, no. So I shouldn't have 2 pounds of potatoes. She's like, so.
Jen, I better take off. I've got a few things I take care of, and I got to
No, I know.
check on Zeus again. I'm looking outside.